And welcome to the Dr. Bob Show. As men get older, they begin to worry about their manlyhood sometimes, about how big those muscles are, about how strong they are, about that inner tube at the waist that used not to be there, about their activity, about their energy, about their get up and go, about their sexual drive, their libido. We'll be spending most of this show talking about that, testosterone and testosterone levels. My guest is Dr. Casey Page, board-certified endocrinologist. He'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll talk about why our presidents get gray hair and why sometimes they get heart disease. And can you get heart disease because of the way you sleep? Well, it could be. We've got a lot of information for you. You'll want to stay tuned. We're talking with Dr. Casey Page, board-certified endocrinologist, and we're talking about the effects of testosterone on men. Casey, welcome to the Dr. Bob Show.
Thanks, Bob.
Tell me about testosterone. What is it and where is it made?
Well, it's a hormone. It's a very common hormone. Both men and women have it. Of course, men have it more than women, but it's produced in the testicle or the testis, and it affects a lot of things in our lives with men. Obviously, when in fetal life, it has effects for virilization of males, and then obviously at puberty causes more masculinization of men into men versus boys, and then has ongoing effects to help even things like beard growth, body hair, obviously genitalia, sexual drive, libido, but helps a lot of kind of more softer things like just stamina, pep, mood, bone health.
Pretty important hormone that we've got. Does it stay level the entire life, or as we get older, does it start getting lower?
As with many things, you know, it tends to kind of peter off a little bit with age, and so it goes down a little bit, about 1 to 2% every year after age 30. So it's on a little bit of decline after age 30.
So by the time you're 70, you've had a lot of 1 or 2% losses there.
You can get down there pretty quick sometimes.
So if the testosterone level starts getting low, what symptoms do people have?
Well, they're very vague sometimes. Men can just get rather sort of apathetic, fatigue, moody, grumpy, don't want to get off the couch after supper. Their wives are beating them to go do some honey-do list, and they don't want to do anything.
They'd rather watch the ball game than they would get out and work.
Drink a few beers, no. But it's softer things. It's just fatigue, maybe low interest in sex, you know, maybe less erections, probably erectile dysfunction could happen.
So if a person starts getting that way, do they think about their testosterone levels? Do they wonder? What about their muscle strength?
Well, muscle strength, certainly. If they go to the gym and they're not able to do as many reps or bench press as much as they used to, they might be aware of that. Certainly a lot of the gyms, a lot of the men who frequent the gyms a lot are very aware of that, and there's a lot of sometimes anabolic steroids in some of the gyms with men who are doing bodybuilding. So there's a lot of interest out there, especially with the advent of commercials and internet. Men are aware of this low T phenomenon, and we see commercials for various products on there. So there's more awareness than there used to be about symptoms of low T.
So if somebody is just more apathetic, they don't have the strength, don't have the sex drive, they can get their testosterone checked?
Correct. It's a blood level. It's highest in the morning and tends to go down as the day goes on. So although it'd be better to do a morning blood draw on someone, you don't always get them there in the morning. If you're a physician, you may have a 3:30 appointment and you have to get them there while you can. But if a person had sort of borderline levels, you might bring them back for a morning blood level to be sure, because might be higher and better valid at that time of day.
Now, when testosterone floats around in the bloodstream, is it a free testosterone? Is it bound?
Well, there's a hormone called sex hormone binding globulin that binds up most of your testosterone. So most of what we see in a total testosterone blood test is not what the body sees. There's only a small, minute fraction of it that is not bound to that protein and is free to float and interact with the tissues and give us the effects of testosterone. So it is the free testosterone that is the more clinically relevant value. And so Although many times it can correlate well with the total testosterone, it doesn't always. There can be binding issues, or if you have more or less of this protein, it can make the total and free be different and not correlate well.
So it's the free testosterone that we're really interested in.
Correct.
As far as its effects on the body.
Correct.
And when that goes low, if you're losing 1 to 2% a year, it seems like almost everybody by age 60, 65 would be deficient.
It could be that way. I mean, it varies depending whether you're more in the 1% category or maybe the 1.5% or 2%. But certain things tend to accelerate that. I mean, if you're obese, that tends to make you have worse drop in testosterone. Say if you were an athlete when you were younger and had a concussion and had a brain injury, that can increase the chance of having low testosterone. Just even things such as stress can tend to lower your testosterone. It tends to turn off your brain, the hypothalamus and pituitary's drive to produce these hormones.
Now, where does the pituitary and the hypothalamus, where does it come in as far as the testes go and as far as testosterone production?
Right. We call this an axis, and everything in endocrinology is an axis. So it starts up with the hypothalamus, which is really your master gland, and it sends out a hormone called gonadotropin-releasing hormone, which interacts with the pituitary, which in turn makes two different hormones. One's called LH, or luteinizing hormone. The second is called FSH, or follicle-stimulating hormone. The LH is the one that is in turn floating around in your bloodstream and making your testes produce testosterone from the Leydig cells in the testes.
So if the testosterone level goes down, does this LH, does it try and stimulate more and more so its level goes high?
Right. We have a feedback loop in endocrinology. So normally, if say your testosterone goes low, your body should sense that up here and say, give me more, and put out more of that luteinizing hormone trying to drive the testicle to make more. So if testosterone goes down, the LH should be elevated, but many times it is not, and there's problems up here.
Okay, so you'll have pituitary problems then.
Correct.
That aren't driving
Correct.
the production of the testosterone.
Right.
Is it easier to figure out what's what? Is the treatment the same?
Well, many times the treatment is the same, but say you had a younger man and the problem...
How young?
Well,
20,
I don't
20,
know.
30?
That changes all the time depending on my age. But say someone maybe 20s or 30s, it's incumbent upon, say, me to figure out whether the problem is here or here. If they really have, say they had damage to their testicles, say they had cancer when they were younger, it had radiation, chemotherapy, had trauma to their scrotum, something that injured that, maybe they could even have fertility problems and nothing could make that work. If they have a problem up here, we can give them hormones that simulate their own luteinizing hormone and follicle stimulating hormone to help preserve fertility. Say they had low sperm count, low testosterone, you can make that go up by certain hormones. If the problem is just the testosterone and you're not worried about fertility, then you may just give testosterone itself.
When you see patients that have low testosterone, what is the biggest thing you see? Is it muscle loss? Is it increased fat distribution? Or is it small testicles? What is the big?
Well, like the small testicles, that's kind of a little bit of a later thing. It can happen. It depends on how long-standing the problem has been going on. So many times they're being brought in by their wife, or they're just sent in because the doctor did a screening value and it's low, and because they complained to their doctor of being fatigued, no interest in anything. Maybe they were getting a little dumpy and a little fat, and wanted to see if there was something they could do to help them.
We're talking with Dr. Michael Bernard, board-certified internist. Mike, thanks for coming to the Dr. Bob Show here.
Glad to be here.
When people come into your office, do they ever worry about men, about their testosterone level?
They do.
Do they ask you about it?
They
Doctor,
do.
could you check it? What are they worried about? They don't have vim and vigor and muscle vitality? What are they worried about?
Yeah, they're worried that as they're getting older, their strength's going down, their energy levels are going down, or maybe their sexual function is not quite what it used to be.
So testosterone has a lot to do with how big my muscles get.
It has something to do with that.
I work out regular, but my muscles are not as big as they used to be. would testosterone help me or would it be dangerous?
Well, there is a normal decrease in testosterone as men get older.
So my testosterone is not as high as it used to be?
That's right. And I think the people we're interested in are the people who are not just having lower than normal testosterone levels, but the levels that are quite low, the ones that are really responsible for people.
And in your practice, what do you see when they've got that essentially absent testosterone?
That's right. Well, they'll have weakness, fatigue. They're not quite depressed, but they don't have the energy they used to.
Now, if you see somebody that says, I'm worried, my sexual function is not as good, my muscles are not good, I feel a little tired, I looked on television, saw where I could get energy with testosterone, and the levels are normal when you send off for the levels, what do you tell that patient?
Well, testosterone is not for everybody. It's for people who really have low testosterone values and who are consistently having low testosterone values. And those people we should use replacement or at least consider it. And the people who have normal testosterone values, we tell them, look, let's go out, let's exercise more. Perhaps there's another reason. Is it your thyroid? So, for example.
So there are other reasons that make people feel tired and make them sort of listless. Mike, thanks for coming to the Dr. Bob Show. It's good for us to know that just because we're getting older and we don't feel as good, it may not be our testosterone. Thanks for coming.
Thank you.
We're talking with Dr. Casey Page, board-certified endocrinologist. We've been talking about the effects of low testosterone. Sometimes lack of energy. We just want to sit on the couch. We don't have the get up and go. We don't do the wife's to-do list. We are not as sexually excited as we were previously. Our muscle mass may not be as good. And so we think about these things. We go to the doctor. It's the free floating testosterone level that we're interested in, but we're also interested in the brain telling the testicles to put out the hormone. Is that pretty much summary of what we were talking about?
Pretty much it.
So let's talk about it. Well, a patient comes in and he's heard watched the commercials and he's had a screening test and it's low. How do you evaluate that patient? Do you just get another level? What do you do, Casey?
Well, we check different things because sometimes there can be certain other hormones, prolactin, even estrogen could be high in men that could be inhibiting their own testosterone. So we rule out some of the things that could be causing some low problems, and barring that or a problem with a pituitary tumor that we're missing something as a cause, we may give them a trial of testosterone and see whether they feel better. Again, just feeling poorly is kind of very vague, and we don't know always that that's the cause, but it may be, and there's fairly few downsides with testosterone, and mostly good sides.
So what's a normal level for a 60, 65, 70-year-old or a 40-year-old?
Well, unfortunately, they have a normal range, and they don't have an age-specific normal range. So it's kind of hard, but we try to decide whether it's appropriate for the person's age. If, say, the normal range in our lab, say, is 241 to 827, I believe. Some of the other labs will say 300 to 1,000 the total.
That's the total. But we're not as interested in the total.
No, the free is a different units, but it's 50 to 200, but it's in a different type of unit. But so it depends on whether the doctor is following the total or following the free. Sometimes once we determine there's a good correlation there, the total is a little bit more easy to obtain, a little bit cheaper test, and most offices do it well and easier. Free testosterone has a few more methodologic problems associated with it sometimes.
So give me an example of a level that somebody would come in that wasn't feeling well, and you felt by taking the history that it was compatible with low testosterone. What would their blood level be? Well,
say we saw a 40-year-old man and their level was 250 or 225 or something like that, and the doctor sent them over and said, there's a problem. He had symptoms, feeling poorly. We'd rule out all the other bad things that could have been causing the problem, did a morning specimen perhaps, and decided the patient was a candidate for testosterone. Then we would offer them a trial to see if that helped them.
So what are the different kinds of testosterone for a trial? Because you brought several samples. Show me some of the different types.
Okay. Well, there's different things. There's gels, testosterone gels, that you rub in the skin or various parts of the body. They may be on the arm, they may be on the underarm, they may be on the inner thigh as the type of gels. There's things that you can put sublingually under your tongue to absorb into your bloodstream that don't go through the liver and you're not taking orally. There's not really a pill for testosterone for men because it has to do with the liver metabolism that's not good. So we tend to do either things like gels for the skin, shots that you take intramuscularly, say once every 1 to 2 weeks. There's even things such as pellets that you put in approximately every 3 months into the hip via a minor surgical incision, and they release slowly over those 2 or 3 months. So it depends on things like insurance, patient's preference, whether they don't want like shots, do like shots versus less often rather than putting on something daily.
I would think that the underarm application, the Axiron, and I've seen that on television, it would seem like that would be pretty simple.
It is, actually, and certain things like that are alcohol-based. It dries very quickly.
So how do you know how much to rub it on? You know, if you're doing that all day, you get
Well,
too much testosterone? Can you do that?
But yes, you can get too much. I mean, there's a certain prescribed dosage. You start with, say, 1 rub on each underarm as a starting dose and can perhaps titrate it to as much as 2 and 2. So it depends on each product as they have a recommended starting dose and maximum dose that you might work towards.
So if you put somebody on sublingual tablets or capsules, or whatever they are, or the underarm, when do you bring the patient back? How do you measure what's going on? What do you expect? What do you look for the patient to tell you?
Well, I would typically say I would want the person to maybe get a blood level possibly in 3 to 4 weeks, particularly maybe if they weren't seeing the response I was hoping for, because there may need to be an adjustment process made. I don't want to say come back in 4 months and they're feeling poorly for 4 months if I could have made a change in their dosage that might have helped them in the meantime. So I may want to do a blood level just to make sure we're on the right dose, and then maybe wait a little bit longer, 6 or 8 weeks, and bring them back, see if they have the response you would like for them to have.
Is this a commitment for lifetime?
Well, it can be, not that it always is, because sometimes when you take testosterone for any length of time, it can turn off your own body's production.
Yes.
So that obviously, but if it wasn't going to be there in the first place, it's not going to come back necessarily on its own unless there was some problem you had not identified that might have allowed it to come back at a later time.
So it's pretty much commitment to long
It could be, not always, and people can possibly stop and go back to where they were before if they just choose to, but it may be still feeling poorly again.
Now, what are the dangers? This is testosterone. This is a male hormone. Does it stimulate the prostate? Does it do any problems with the prostate?
Well, testosterone is sort of a important hormone for the prostate. That's what just causes men's prostate to grow over time, even in a normal man. So it is dependent on that. So if you take a man who had low testosterone, perhaps their prostate would grow less quickly over time. So putting it back to a normal level just usually allows it to grow at the same probably pace that it would have otherwise.
Stimulate cancer?
Well, no, it's not thought. There's no data that shows that it stimulates cancer. However, at least it brings on a new cancer that wasn't there. Could it feed a cancer that was already there? Theoretically, yes, because prostate cancer is a sort of a testosterone-fueled sort of cancer. So we have to watch that to make sure we're not bringing on something causing a significant rise in PSA values, the little prostate blood test that we do as a marker for prostate cancer. So that is one of the things that we do have to watch a little more closely.
Do the wives notice the husband doing the jobs more? Do they notice the libido picks up?
Well, that maybe depends on the marriage, but yes, in general, they're typically happier with their husband, even if it's just a matter of they're happier, a little more pep. They can do the honey-do list. They just have more motivation and feel better.
In general, if you see somebody that did have low testosterone levels and you treat them, is it a really nice thing to see that somebody feels better, more active? How often do you see that, Casey?
quite a lot. I mean, that's why I said there's many good upsides and not so many downsides. So it's actually a pretty good feel good for the doctor too, because people come back and say, oh gosh, yeah, I feel so much better. I can get things done. You know, I'm not moody and grumpy and, you know, biting everyone's heads off all the time at work or at home. So it feels good for me to help someone if they do feel better, yes.
Casey Page, you're a wonderful teacher. Looks like the testosterone application would fix all the grumpiness in the world.
We hope so.
That would be good,
That would
wouldn't
be
it?
nice.
Thank you for coming and teaching us about low testosterone and what we can do for it.
Thank you, Bob.
Wonderful discussion. You'll want to stay tuned. We're going to be talking about our presidents of the United States. Why do they turn gray-headed? And why do they have heart disease? And if we have time, can sleep have something to do with a bad heart? It can. You'll want to stay tuned. I want to thank Dr. Casey Page. Wonderful discussion on low testosterone. If you're grumpy and tired, could that be the cause? Might have to see your doctor. Now, questions from you, the viewer, that I think will be important to your health. Dr. Bob, I notice our presidents all get gray hair during their presidency, and it seems that some of our recent presidents have had heart disease despite exercising. What seems to be the problem? Two excellent questions. Let's talk about gray hair first. When hair follicles grow, there is melanin. That's a pigment that's right on the surface of the hair follicle there. So it's responsible for the color of our hair. It can be that stress or lack of sleep causes that melanin, that pigment substance, not to coat the hair as it grows, and if so, we become gray-headed. At least that's one of the theories of why people become gray-headed. The second part of that question was, a couple of our presidents have had very serious heart disease despite exercising on a regular basis during their presidency. Is it stress and lack of sleep that does that also? Well, in the Korean War, they took some soldiers that died at an early age in their 20s, between 20 and 25, and at autopsy, they found that the blood vessels, the aorta, the big blood vessels, had lots of cholesterol deposits on those arteries, where if you took somebody in the States that died in an automobile accident that wasn't going through the stress of war, their blood vessels were more normal. So we know that stress has something to do with the deposition of cholesterol onto the arteries. Now, what can we do about that? Well, we need to be sure that we keep on exercising. We need to know what our cholesterol level is. And if our bad cholesterol, the LDL, is too high, then for sure we need to take medications if diet doesn't work that will lower that cholesterol, and maybe, just maybe, that will save a life. I certainly hope so. And now question number two, Dr. Bob, how does sleep affect the heart? Well, you know, there's nothing like a good night's sleep. We sometimes don't really know what sleep does. We try and get 7.5 to 8 hours of sleep every night, and we know it refreshes the brain. It makes us feel better. If somebody is not sleeping well, then what can happen there? It stresses our body's adrenal gland. So let's say we have sleep apnea. Let's say we're snoring and we stop breathing, and the brain recognizes that we stop breathing, and the brain says, hey, wake up. And when it tells us to, hey, wake up, it stimulates our adrenal gland to put out hormones that will put a stress on the heart. So a lot of times, people that are having sleep disorders, especially people that snore, that have obstructive sleep apnea, the oxygen level will go down while they're not breathing. And when the oxygen level goes down, it makes the heart irritable, and people can have rhythm disturbances, arrhythmias, or people can even have heart attacks in the night simply because of the stress that occurs. A lot of times people with sleep apnea will wake up with headaches. They wake up with headaches because their blood pressure is elevated. And the blood pressure is elevated because that same adrenal gland, fight and flight, is putting out the hormones. So sleep apnea is something that needs to be evaluated. If you know of somebody that is snoring, that stops breathing for short periods of time, 5-10 seconds, and wakes up with little jerks, then you can be sure that other things are going on to stress the heart, stress the blood pressure, stress the vessels. Needs to be evaluated. Frequently, these people are placed on CPAPs that breathe for them, that force air beyond, and we don't have those patterns of stopping breathing. It's all the time that we have for this show. Please be exercising. It's the most important thing you can do. It doesn't matter what kind of exercise you do, but get out and do it every day. Walking is good. Get your tennis shoes out. Riding bicycles is great. You get to travel a little bit longer on a bicycle. Walking in the gym. Doing weightlifting is good. Weightlifting will also help us as far as exercise goes. Reduces stress, reduces our blood pressure, reduces our weight. Eating properly is something that we as Americans don't do. We're marketed to eat sometimes bad foods. So we need to eat more fruits and vegetables in the morning, at noontime, and at supper time. Less fried fatty foods. We all know how to eat well. Get 8 hours of sleep. If you're snoring and you're not getting good sleep and you wake up not rested, talk it over with your doctor. You may need to get a sleep specialist. And what is it that we want most of all in the Dr. Bob Show? It's that laughter in your life. Take a look at yourself in your mirror. Are you laughing at yourself? Are you laughing enough? Are you giggling? Are you telling funny stories? Is laughter a part of your life? Have you lost that? If you have, you shouldn't. Get back to giggling and you'll stay healthy.